What's up, guys? This is Dr. O. Thanks so much for joining us. I'm super excited. We're going to talk about implants. We're going to do a live surgery today. So this is going to be fun where you can post your questions. I'm going to get to see what you guys are interested in, questions you might have about implant dentistry and how we place this implant for my wife. We're going to begin in just a moment, but be sure to like us on Facebook, follow us on Instagram, and subscribe to us on YouTube. Thanks so much for joining. The surgery was recorded on a student doctor day, which is pretty exciting. We had a bunch of students out. And you can visit rheostat.com to learn more about upcoming events that we have. Let's go ahead and get started. Post those questions. All right, first thing we're going to do is go over how we planned the implant placement, because as anything that turns out amazing, you got to have an amazing plan. So we do that first. We don't just make incisions and place implants. We really think through the angulation of the implant, the depth of the implant, how it's going to work for the future tooth that's going to be put on the implant. And so the first thing here you'll notice is we go right on into designing in a special software called BlueSky Biomed. I import first here the 3D cone beam. And so this is think of a 3D x-ray that puts together exactly the dimensions of your teeth and the bone, gives us some idea of density and where we have to avoid things like your nerves. What I just pulled in there is called an STL. It's a 3D image of her lower teeth taken from our CEREC scan. So think of a 3D model and then a topographical model. The topographical impression is the green. The 3D impression or digital X-ray is what you see there in the white. And so now we've got those two aspects put together correctly. And I'm just going through and being extra thorough here. I'm going to put in tooth number 30. I want to design it, and let's see what that tooth shape needs to be. I'm going to move this over there, drop that tooth in, and the tooth is red, obviously. It lets us really see. Very crispy right there, huh? So we're going to move this tooth exactly into the right position. I want to make sure that that position is going to be 100% accurate, and it's going to be allowing me to plan that implant with what is really going to be a tooth that she could chew with. So right here, I'm going to go ahead and draw the nerve. The software is going to plot the placement in yellow of, there you go, you can see it. Now we've got lower nerves, right and left, and we can see where we need to avoid definitely placing an implant. If you were to place an implant into this site, the patient's going to lose all the feeling in their lower left jaw, some muscle control even, and maybe have a droopy lip. And so obviously a really significant issue. We definitely never want that to happen. And with this software, it makes it pretty much impossible for that to happen if we're careful in our planning. I'm going to compare this implant to the position of the crown, which I know the crown's in a good spot. And I'm going to see that it's angled correctly, splitting kind of the difference between our molar and our premolar in all directions. So in between, so we're going to call that, it's called mesiodistally. I want that to be placed correctly. And then buccolingually, so from the tongue to the cheek, I want it to be placed in the middle. And so both of those are going to be tweaked here as I'm kind of playing around. And now we get it right down the middle of that crown. Now you can see buccolingually here. I need to move it over a little bit. And now I can assess the length. And now we can see buccolingually that we're going to have good emergence from that implant to be able to create a nice crown and be at the right depth. Now you can really see that distal root, right, where the molar was. And we can see that we're a good 2-3 millimeters away from our nerve. So we know we're in a safe spot. There I am removing the bone so I could really see, hey, how close am I to the nerve with this implant? We're quite a ways away. All right, so now that we're ready to design our guide, kind of fine tune this implant placement there, right down the middle of that site. That ring is going to be what you'll see in the guide here in just a bit. When I go to place the implant, you'll see that ring is going to be 3D printed in that guide. But that ring is proper height, and it's going to give us the proper angulation so that implant goes exactly where we planned it. You can see zoomed in, we really got the dimensions right. So this is the proper position for the implant. It's right down the middle of the bone. Got good bone health on either side, good emergence for the future crown. So I'm thinking this has got to be the right spot, right? This is good positioning, going to be a great future tooth for her, and she'll be able to chew the rest of her life with that. Should be very healthy. Now it's time to create our implant guide. All right, now it's time to define the borders for our guide. In order for the guide to be stable, right, it needs to cover at least one tooth or two teeth behind, one here in this scenario, and then come up to at least kind of close to the midline. That way it won't rock, it'll snap right in, and it'll keep the implant from moving at all and be very accurate for us. So I'm going to draw the borders of that, and then I'm going to add what's called a guide window. That window is going to allow me to verify that the guide is fully seated. It's one thing to create a guide, right? We want to do that, but if it doesn't seat correctly and it's not snapped onto the teeth fully, and I can't tell that and I trust it, then I've not done anything good there, right? I've placed an implant in the wrong position thinking I used something that helped me do a more accurate position. So the guide fully seating is really important. This is where I'm going to go ahead and define that border and then add in a guide window. This window is going to show up. You'll see it here in just a minute when we go to snap the guide in the mouth. You'll notice that window is allowing me to see the canine is fully engaged with our guide, and so I know that we're accurate. Now it's time, after I get that, to go ahead and do a proposal. There you have it. Now we have a really nice customized guide for Lauren. It's going to snap onto the teeth. It's going to help me make sure that the implant goes in the right spot. That way we get a wonderful implant. We're going to put a label on it. That way we know whose it is. We're going to put the size of the implant that's been chosen, so that way the implant's going to be accurate and fit exactly like we had planned. And then we're going to send this off to our 3D printer. 3D printing is phenomenal. It allows us to do this in about 30-45 minutes. These guides, like I said, they snap in place. They're that accurate. So we're going to place a 5 by 11.5 implant. Now it's time to place the implant. We've done a lot of planning, right, for something that should be very straightforward and go very smoothly for the implant placement. That's kind of the idea. And then in the end, we're going to take our impressions. So you just saw the planning. Now you're going to see the placement, and then you'll get to see the impression. Let's get over to placing the implant. Here we are. We're placing the implant guide. This is on my wife's lower right. Sorry about the hair getting in the way, but we're going to go ahead and give some anesthetic. Now, what's really slick about dental implants, they don't really cause pain in the bone. And so we don't need to go to the full extent of numbing up like we do for an extraction. We can really just make sure that the gums are numb, and that's what I'm doing right here. That way we don't have a patient that's numb for hours. My wife particularly hates being numb, and so for her, she didn't have to have this droopy lip and be numb for hours. So we just gave some anesthetic right there on top of the gums. You'll notice just a couple of little spots, really hardly any bleeding there. You'll notice the site there is really bulky. That's another good thing to kind of mention for dental implants. If you're going to have a tooth taken out and there's an infection present. So the reason we didn't place the implant the same day we removed the tooth is because if there's an infection present, we don't want to risk that infection messing up our implant success. So here I am trying in the guide for the implant placement. This guide has been custom fabricated for her mouth using 3D software. So we look at the bone and we see where the implant can go. We plan that out. And then this is 3D printed. You can see there's a window there that I'm verifying that this guide seats properly. I can see there at the molar side it seats, and then at the canine it seats. Here I am just marking the spot with some blue dye. That lets us know exactly where the tissue punch needs to be, and tissue punch is going to be all we need. We don't need to make this big incision. So you'll notice a lot of surgeries or videos that you might watch about dental implants. They're going to make these incisions, and they're going to reflect back the tissue. That is really more aggressive than we need to be because with this approach, we know exactly where the implant's going to go. All right, so here you'll notice that I'm doing a tissue punch on the gums to using a little device that's really called a tissue punch. And now I'm going to remove that piece of gum tissue. And the reason I can do that is we have great gum tissue. You'll notice because we grafted and kept that nice bulky ridge, that tissue remained nice and healthy. This implant we're going to use is called a Ditron Ultimate implant. I really like it. It's got a lot of great properties. But here I am using what's called a bone profiler. Sorry, am I leaning into the space there a little bit. But that profiler helps make sure that the site where the implant crown is going to come off the implant is nice and flat. And so that's the first instrument I like to use. We don't want to have a regular bone. We want to make sure it's nice and flush. There was the pilot drill. So the pilot is going to be a 2 millimeter diameter pilot. It's usually 6 millimeters in depth. And I believe this implant here I'm placing is a 5x10 implant. So that first little pilot was a 6 millimeter. This next one's going to be an 8. That's what I'm showing right there. And then I'll use a 10 millimeter pilot. And so, and I said 2 millimeter diameter, but 6 millimeter length, 8 millimeter length, 10 millimeter length. So guided surgery allows us to incrementally increase the length, our depth of our osteotomy safely. Now I'm onto this red, which is a 2.5 millimeter diameter. So I'm making it just a little bit wider than the 2. And I'm going to do that with a 6, an 8, and a 10. And as we do that, what we're doing is we're just slightly making the site a little bit larger, and really making sure that I'm gauging the bone, how it feels. The patient doesn't feel a thing. My wife is very comfortable here. No pain involved. And so we'll do this again. And now we're going back in with a little larger. This is actually a 3.0. I can tell by the shade of that ring. It's a 3.0. So 3 millimeter diameter. That was a 6. Here's an 8 and a 10. And you can see we use plenty of irrigation. The instrumentation we use is all designed specifically for implant. It's sterile water coming right out of sterile bags that we get, so sterile saline. And we're able to use that. And there's the 10 millimeter depth. No pain, very little bleeding. We don't have really much going on here for the patient. Probably the worst part, staying open for 8 minutes or so here. 8 to 10 minutes. I'd say on average, guided implants take maybe 7-8 minutes is kind of the going time period for that. So really doesn't take very long to get an implant. Now it's time to go ahead and add put the implant into that site. And what I'm doing right now off screen is I'm attaching the connection to the implant. And there's our implant. You can see me going there with it, and I'll back my head out of the way, hopefully. And I start driving that implant in place. There we go. And then I'll finish it up with a torque wrench. And this torque wrench is what really is going to help us guide it perfectly straight and flush to the proper depth. And there we go. Get my head out of the way. That's what I'm doing right there. So that torque wrench allows me to do that. Guide it right down. There's a line on that torque wrench. Can you see it? Yeah, you can. So that line is where I'm taking that implant to, right? We want to make sure it goes down flush with that. That tells me that we've got it at the proper depth. So think about guided implants. They're not just 3D planned for angulation, but they're planned for depth. And so we're avoiding the biggest issue here would be that she has a nerve that if we were to hit the nerve, we could cause numbness in her joint. So obviously we don't want to do that. And so what you're seeing me right now do is the osteotomy is a judgment on size and how much space we need. Is I made the osteotomy just a little too small, right? Which is fine. I'd rather be smaller than too large because I can always make it larger. So I backed out the implant. It goes right back into the sterile connection. That's one thing I love about Dytron and the way they ship this is the implant is going to come out of a sterile environment and go right into a sterile holster that it came in, stainless steel holster that it came in, and then we're going to make that site just a little bit larger. And see, I'll go in here with a little larger drill, same thing. And then we'll go back with the implant after I feel like, hey, I've given it just enough more room to get that implant in place. You'll also notice my wife's got pretty bright white teeth. I did upper 10 and lower 10 veneers on her. So she's rocking some nice veneers. This implant crown will make the same shade. Stick around, I will show you how we don't just place the implant. We can take an impression, design the implant, and have it ready for our patient when they come back after healing. And healing time, typically I wait anywhere from 4 to 6 months, kind of depends on the patient. If we graft it, I'm going to maybe wait a little bit longer. But there I am driving the implant in place. A little more clear shot this time of how that works. And then finishing it up with something that's a little more tactile. Placing an implant with a handpiece with a motor is different than placing it with your hands. And so I like the feel of knowing how much resistance I'm getting. We want the implant to have some pretty decent torque so it doesn't move around. And has some good initial stability. This is a bigger issue when we're doing a front tooth, right? If you get a front tooth knocked out and we're placing an implant there, we really need to have some strong torque to make sure that implant won't move while we have a crown on it, hopefully for you, so you can smile and not have to be missing that front tooth. Guided implants are phenomenal for cosmetic implants. This obviously we would not consider a cosmetic implant, although every implant I try to make look nice and cosmetic. But there I am getting a final torque, just finishing it up, and there we are. We're done. Got the implant in place, right depth. Go ahead and take out the implant mount. We can remove our implant guide. Total time here, we're probably somewhere around 8 minutes, 8 to 10. Guides fit pretty tight, so you'll notice I have to kind of wiggle it a little bit, but there we are. So now we've got the site, and I'll use a mirror here so you can really see it. So the implant's just that little top portion right there, you see? And that's we're gonna have an implant abutment that gets screwed into that. So an abutment's also another fancy term for an attachment. I tell most patients just, why use the word abutment? I like to use layman's terms, keep it simple. That's an attachment that we're going to screw into that implant. And on that attachment, it's usually the attachments we use are usually called tie bases or titanium bases. And we're going to attach a porcelain all Emax material or super strong porcelain material designed to be bonded to that titanium and screw that into the implant down the road. But here I am profiling. Profiling is a way, I don't know if you've had some of those that maybe are watching this are going, this is different than the implant that I've already gotten, or you may already have implants and struggle with maybe food impaction or issues with that. This profiler allows us to shape the gum tissue in a way that is optimal for the healing process and then for your future crown. So we want crowns off of an implant to come off and fill in these gaps that are going to be the space in between the implant and your neighboring teeth. That way you don't have to suffer from food impaction and having stuff and gunk get up underneath it, irritating your gums. So we want obviously long-term health. The great news is implants typically last a lifetime. And so if we're careful about not just placing it in the right spot, but then making sure that the crown is part of this plan and is done ideally, then we give our patient the best long-term success. If I was going to stress one of the biggest reasons a guided implant is worth doing with a dentist that is comfortable placing implants and then restoring them with the crown is we can really see the whole picture very clearly, and the guided process allows us to idealize your future crown. I kind of use the example or analogy that when you're going to build a home, you don't design the home or design the foundation and then the home, right? We design the home and then the foundation has to help support the home. And really with dental implants, we've always done it reverse in the past, right? We place the implant and then we figure out how to put a crown on it. With this approach, we are really designing in software and 3D imaging, we're designing your future crown and then figuring out how we can best place the dental implant to work with that crown. So that's what we did here, and we get an optimal result. So obviously want all of our patients to have successful implants and have very little issues with them. So here's the titanium base. That's what you're seeing me snap down inside of that implant. I'm going to tighten that down with this little screw. We do 3D imaging to do all of our impressions, so we don't have to do the gunky impression material. So if you've had a dental implant and the experience, you might have had that before where or any crown, honestly. I mean, crowns, veneers, implants, a lot of them are going to be the goop in your mouth. You wait for 3 weeks while you wear a temp. Obviously with dental implant, we're going to be waiting until this site is fully healed. That's where the bone's going to lock into the implant. We call that osseointegration, but it just basically means the implant now is locked. The bone has become one with the implant. Bone connects to implants differently than it does your teeth. With your teeth, it's going to use some ligaments. That's why teeth, if you push on them, we can move them with braces, with Invisalign. Whereas with an implant, we're not going to be moving it. Once it's locked in bone, the bone becomes one and attaches itself to the implant. There is no ligament in between the bone and your implant. All right, it's awesome. So, and now that we're done placing the implant and everything's in the right spot, we can do another little step. That is take the final impression for the implant crown, and that allows us to digitally capture the position with our CEREC machine in our office. And then we design the crown, and then the next time the patient comes in, which would be about 6 months down the road, depending on the site, but usually 4 to 6 months, then we are able to screw in the permanent crown. So we're gonna go ahead and take that impression. So check this out. We're gonna take the impression, design the crown. And so we just gotta nail this position, take our impression. That little device there is called a scan body. So I'm going to take this scan body and we're going to put it on top of this titanium base. And I'm going to line it up and make sure that's fully seated. And then we're going to take a digital scan. So it's going to be with our CEREC machine. We're going to wand over the tooth or over that scan body, and that triangle that's on top of it is going to tell our software exactly how that implant is placed relative to our other teeth. So that way we can design an implant crown and get it properly set up within her bite. All right, so here's our CEREC machine. We're able to install our CEREC Prime Scan. I'm able to take this special camera and I just wand over the site. That blue light is sending some information. It's going to bounce right back and help us develop this 3D model of her teeth and that implant position. And you'll see in the software how that all looks and how we're able to pick all this information up. Pretty amazing. We can do all of that in just a matter of 30 seconds, right? Do that for the lower arch. We'll then do it with the upper arch. That way we're capturing both arches, and that way we can then get a bite and have the patient bite nicely and tight together. All right, so here I am just removing the titanium base. I'm going to image the gum tissue first before we put the healing cap on. That gum tissue is going to be how we tell the software, hey, this is where we want to come off of or out of the gums. So that's what I did there. We call it a gingiva mask impression. So I'm taking that here. So, implants is about placing the implant in the proper bone and getting it in the right space in bone for the future crown, but it also has a lot to do with how we're going to use the gums to be healthy and put the right amount of pressure and shape, so that way everything looks natural at the end, right? We want our implants to be not something that looks like an implant. We want it to look like a natural tooth. So there we are, going to take a bite. So she's biting all the way down, and that way when we make this implant crown, she's not going to have issues with biting together and having it messing her up, going side to side, and finding that she's colliding too soon on our implant crown. All right, here's our healing cap, and then we're going to seat this down on the implant, tighten that down. This one here is a 6.5 healing cap, so it's 6 millimeter diameter, 5 millimeters tall. So yeah, you can see now we're just tightening it all the way down, getting it where that won't get loose during the healing phase. Now we've placed a dental implant and we've taken an impression. So here at the end here, what I'm doing is I'm using the software to tell exactly where that gum tissue is that I want the implant crown to come out of. And then we are going to tell it to go ahead and design for us a crown. So we've cut out the site where we know the implant's going to go. We've told the software there's where the implant is, and then now it's going to give us an initial proposal. What you're going to notice here is I'm going to go back to this phase here called positioning, and I'm going to take the software and move that tooth around and say, you know what, yeah, you had an idea of what I liked, but here's something I'm going to like a little bit more, so I can give it the software basically a better suggestion. And so I'm going to make the implant crown just a little bit more narrow. It was a little bulky. No one likes having a big old fat tooth in there, so we don't need something that big. And then I'm going to make sure that it's wide enough for the space. And then we need to make sure that this lines up correctly with, we call them marginal ridges, but basically just the height of that connection or that space between the teeth. We want to match the height of the adjacent teeth. We don't want to have an implant crown that's sitting down too low. Now, this is also another good point of discussion. If you're missing a tooth, the longer you wait to address the missing tooth, the bigger issue it can be to get that tooth in the proper height, because what's going to happen is the tooth above is going to come down. As the tooth from above comes down, it limits our ability to build your implant crown at the right height. So if you're missing a tooth, and I know you're probably getting along okay, but there's probably some repercussions, and one of those is your teeth are shifting. The one behind it shifting forward, the one from above shifting down. So with this way of addressing it and we're going to do this whole thing, even with grafting and the implant placement and waiting, Lauren's only going to have to wait about 10 months total time between removing the tooth and getting our implant crown, which as long as you're within a few years, we see very minimal shifting for most people. But much longer than that, you can have some pretty significant shifting. I've seen 3 years be a lot for some. So, don't delay implant placement if you're missing a molar. This is a really important tooth for her because as she's chewing, she's going to be chewing on the other side and wearing down other teeth. This one's really helpful for that. So what I'm doing right now is I'm adjusting the shape, smoothing it out, addressing contacts because I want to make sure that when she flosses, it snaps correctly. You'll notice that I'm going around and make sure that she's not biting too hard. And so that red is basically spots where the bite is going to be a little heavy. I'm getting that down to green because I know in the software when we have right around green, that's going to be a good bite. We want her to be able to use this tooth. We just don't want it to be, banging really hard. So we go ahead and adjust that, smooth everything up because, we love smooth materials in the mouth. We don't want anything to be rough. And so you'll notice I'm doing that here, shaping it all nice and smooth. Then I'm going to address this contact a little bit, get it to where we have a nice, clean, green in the software on our system is really the nicest connection there. Finish the smooth, and then now we're ready to mill. So our milling machines in our office, we can take this restoration now that we've designed, and we can get it sent over to our milling machine, make it, and have it ready for her when she's fully healed. In this scenario, I'd wait for somewhere around 5, maybe 6 months because we did graft pretty significantly the site where the molar was. Keep in mind, some teeth are shaped differently, different roots, right? I mean, molars have 2 roots, and when we took this out, we had 2 pretty decent sized holes. We grafted that, so and we had some infection. So we're trying to be cautious and make sure that the implant is successful and works long term. So finally, just getting those marginal ridges, like I was telling you about, we want to match those up the best we can. And that's what I'm doing there. Make sure our contact is broad enough. That's what I'm doing there. So I know this is a lot of information for maybe somebody who's, just says, just do it for me. But I know there's those of you out there, I've seen it in our comments and then on our YouTube channel, that they like to know a lot of stuff. So that's why we do these lives, a little bit more of a deep dive into how we make dental implant crowns and dental implants. So I kind of guided you through the whole process here of how we can make a tooth that didn't exist and give you one to be able to chew and protect your other teeth. So now we're ready to send it to the milling machine and mill it out of this block of high strength porcelain. So that's the next step. We're going to make it, and it'll be ready in a few short minutes, but it'll wait for months until we put this one in. Now, if this is a front tooth, we would be making this same day and putting it in same day, and then we'd keep it out of bite. That way the patient wouldn't be able to chew on it and put too much force on an implant that's trying to heal. Oh, you notice I picked something else up. There's the contact, right? The tissue pressure I was talking about. I'm going to give, a little bit better tissue pressure. So that's what I was doing, is adding a little bit more so we don't have any hygiene issues, right, where we're trapping food. Like to avoid those. I don't know if you've ever had a crown or dental work and all of a sudden you start trapping food, but that's usually something that we can address and fix and be pretty meticulous about. So that's how we limit it right there. So we planned it, get it ready to mill it, and then put it in. Well, I hope you guys enjoyed that. That was a lot of fun. So thanks for all the awesome questions. I'm going to try to get through as many as I can and try to not be too long-winded, but we're going to have an information night coming up at Innovative Dental. So if you're local, definitely stay tuned because I'm going to give you all the details about that coming up. So first off, Cameron, you're from Facebook there. You said, how on earth do you avoid the sinuses? Well, there's 2 ways that we can help do that, right? One is going to be add a little bit of bone to give us some space. That can usually be done when we place the implant, so it doesn't have to be 2 separate procedures. Or we place a shorter implant. So we can place implants all the way up to, or all the way down to the size of about 6 millimeters, 6 to 8 millimeters is kind of the smallest we like to place. So that's a great option. We have Gambler from YouTube. Maybe he's a gambler, I don't know. Don't gamble with your implants, man. So what kind of financing is available? So we have lots of options for our patients, as you can imagine. We want to make sure that we can fit things into people's budget. And so we use multiple companies that help us create payment options for our patients. We can get things down to a few $100s or less, depending on your benefit plan. So if you have decent credit, even if I think that we go all the way down to about 550 or 600 credit scores. So definitely check into it. We help you with all of that here at Innovative Dental. We have experts for you. So Lizzie, you're on YouTube, says she needs implants and veneers. Can this all be done at once? And so it really depends, right? If there's healthy bone and not an immediate extraction and maybe good bone beyond the extraction socket. So it really depends on the quality of the bone. We can determine that with a 3D x-ray, but as long as we can determine that we can get a solid implant in place and that your bite is going to be able to be something we can manage from you overusing that tooth, if it's canine to canine, we can place an implant and then do the veneers all at one time. Give you a quick example. Today I had a gentleman that I finished his smile. I did veneers and did a cantilever, or basically a bridge with a fake tooth attached to one of his veneers. We did that as a solution while his implant healed below that cantilever or that bridge. Then he came back today. This has been about 6 months ago when I did the first veneers for him, right? So he's got to enjoy his smile. We cut off that tooth, removed the healing cap from the implant, create his permanent crown, and finished his implant crown today. So he's got a solid implant crown, and we didn't have to load the implant the day of the procedure because of his bite. So there's ways for us to adjust and help people that have all sort of situations and still get you into a beautiful smile. So we have Francis from YouTube. What's the difference between zirconia and titanium abutments? Cost, first off, no difference in cost in our practice. We really don't charge any different. I don't typically use zirconia because we don't need to. We can use a titanium connection and then use a high strength porcelain called Emax. You probably heard about me talk about that before if you're a fan of the channel, but Emax is, can be blocked out. We don't have to see the titanium underneath, and it's super strong and it gives us that longevity that we want. We don't have to worry about something fracturing. Zirconia abutments, a little bit, especially if they're all zirconia, a little more likely to fracture. So, but we use all Emax abutments typically, so we can use zirconia. All right, scoot forward just a little bit taller. Okay, I can do that. Thanks, Michael. You're not supposed to read that. All right, let's see. Abraham from YouTube. Do implants affect your face or bone shrinkage? Fantastic question. That is a big concern. That's one of the main reasons, actually, if you're missing a bunch of teeth, to restore your mouth with implants, is implants stimulate the bone. So when we have implants in place, we don't have to worry about bone atrophy or loss. The stimulation of that bone helps maintain it. So it's awesome. Another big thing is obviously the prosthetics, the teeth. If it's a full arch of implant prosthetics, it can help keep the vertical dimension of the face, and it'll also support the lips and the mouth. And so it makes a big difference. If you go to our Instagram page and you see the before and after, some full mouth reconstruction with implants, you can tell that their face is dramatically different. So, all right, Lizzie from YouTube, do you need to replace the screw? Is it a lifetime thing? So I think you were talking about the implant. Does the implant need to be replaced? I'll answer both, I guess, but implants typically don't need to be replaced. So we're typically talking about a lifetime, or I say the F word in dentistry, it's forever, but it typically implants in a healthy bone with a healthy patient who keeps it clean, very likely to have the implant forever. Now the screw that holds the crown in place or the abutment in place typically does not need to be removed or replaced either. So hopefully that helps you out. Let's see. You have Yuli 1980 or UIL 1980 from YouTube. I need a full mouth makeover. How do I get the process started? So the first thing you do is you head on over to yoursmiledestination.com. Thanks so much for the plug. But go over there and you fill out the form, submit your x-rays. We do a virtual consultation. I'm going to sit there and chat with you, get to know you just briefly, see what your needs are, and we're going to come up with some options and solutions that best suit your needs and get you back to smiling, and then you would fly here. And we usually can do the procedure in one visit. Depends on what it is, but 1, 2, maximum 3 or 4 is kind of how the procedure goes. So awesome. All right, we got Amanda from YouTube. Do you make your guides on the CEREC or on a 3D printer? And so we used to use the CEREC, but with a 3D printer, we can be a little more efficient with our time. We can make more at one time, but we also get guides that fit a little nicer and that we have multiple trajectories for implants, multiple implants per patient. So we're usually doing 3D printed guides at this stage in our practice. So we have a couple printers to do that. So Melanie from Facebook, let's see, does insurance cover implants? It really depends on your plan. Some benefit plans do give you some coverage, and so you might have some discounted rates or at least some help with some payment. But we are, as far as Innovative Dental is concerned, we are in network for many insurances, if not most. And we do offer our own plan as well called the Innovative Smile Club. So most of our patients don't have to pay full price in our practice. So I'm glad that we offer that. It's a nice facility, but we still offer kind of the average fees for our patients. So we want to be a great value for you all. All right, let's go to Laura from Facebook. Oh, sorry, I skipped one. There we go. Marina from YouTube. I'll get to you, Laura. So how do you decide if a bone graft is needed, and what about dentures? So how do we decide if a bone graft is needed? We use that 3D x-ray. So back at the beginning, you may have seen the video, the live, I showed how we design and plan the implant in the bone and working with the prosthetic. We do the same thing, whether it's with a single tooth or with a full arch of implants, anywhere from 4 to 8 implants to help support the whole smile. And so, we do the planning there to see if we need grafting. Now, typically, because we're 3D planning and then placing the implants with a guide, we're very precise. And so we only need about 5-6 millimeters of bone width to have successful implant placements, which means we don't have to graft most of our patients. Now, it doesn't mean we don't graft, but we can. It's fairly straightforward. I did a full arch on, Monday. We grafted at the time of placement. So that's stuff that we can do pretty clearly here for our patients. All right, Laura, let's see. You said, what about full mouth denture implants? What's the cost? So no matter where you go across the country, it's going to vary anywhere from probably 40 to 60 to 70,000 for a full mouth of implants. I know that's expensive, but you're talking about a lot of work there. So per arch, we're talking like gets down maybe 18 to 20,000 to 30,000 ish per arch. So that's kind of the cost for full mouth implant procedure. There's a lot that goes into that. I don't obviously have time to do all that. There's other videos on our channel. I'll keep posting ones that answer that. And if you're local, come to our live event, our event next, July 7th. I'll go ahead and announce that now, July 7th. At our practice, we will put some information on our channels, all of our social media, announcing a little more details. But July 7th, we'll have an in-office lecture on that. I'll go through it. I'll discuss it. It'll be an info night, so it should be fun. Lizzie and Jade, YouTube, is there pain? What kind of sedation? So because the procedure is so fast and we want to keep costs down, and really it can be done painless. I mean, you saw my wife there. She didn't flinch at all. It's a very easy procedure. I just numbed the gums. So really doing full sedation is overkill. It's just a ton of extra cost for the 8-10 minutes it takes to place the implant. So that's not typical that we do that. We do use some great anesthetic. Patients don't feel it. And then the reality is even afterwards, if they're taking ibuprofen, that covers about 90% of the patient's pain. Every once in a while, they'll need a full strength pain med, but really very minimal pain. Most people even go back to work as long as it's not high heart rate work after the procedure, maybe the same day or even next day. So, all right, we got B from YouTube. I had 7 implants and no tip teeth. I have zirconia teeth, but no molars. My face is sagging. What can I do? It's without seeing the detail. Obviously, the no tip teeth is a challenge, right? If you didn't have anything to help give some dimension and visualize and support the bite, my assumption is if I saw you, you probably are missing some vertical dimension. I don't know. And in Missouri, we have, Branson, Missouri, we have the ball knobbers, right? They made a big thing about not having teeth, and they close their mouth and their chin almost touches their nose. And obviously I'm exaggerating, but that effect happens when we don't create teeth that are tall enough or they're worn down. And so we want to get back to the nose to chin height. If you go once again to our Instagram, Facebook, and look at before and after photos, you will notice right off the bat that one of the main things that you see is vertical dimensions addressed and people's faces look different. So good question. All right, so we got Craig from YouTube. Pain level during healing for implants versus extractions and dentures. So extractions are definitely more likely to be painful than a dental implant. And the reason is obviously there's a ligament that's holding the tooth in place. That ligament has tons of nerve endings. And then we also have the nerve that goes to the tooth. And so there's a lot more nerves going to a tooth. There's 0 nerves going to an implant or the bone even around the implant. It's only the gum tissue around an implant at the top of the implant that has nerves in it. So the bone itself does not. And so that's the only thing that's likely to have discomfort. And so we really are, careful in how we suture and place and get that gum tissue. Most of the time we don't have to place sutures, but if we do, we're careful about how we protect that site. And then versus dentures, well, dentures ride on the gums, right? So you're talking about a totally different procedure than anything that has to do with implants. And so something that rests on the gums is always going to have a little harder time healing because it's not supported by bone. And so you've got this kind of roughness and wear and rubbing on the gums. And so dentures, yes, a lot more time to get used to, especially if you had a lot of teeth taken out. But if we're doing an implant prosthetic, we're in good shape. So what's up, Josh? Thanks for saying hello. We've got an awesome patient of ours. Yeah, good to see you, man. So we have Dwayne, YouTube. I see it has I have a cleft lip and a palate. I have a bridge that needs replaced. Is this something that you are able to do? Quite honestly, yeah, I'm sure there's some options that we have for you. So it'd be awesome to meet you. It would be great to take a 3D x-ray and evaluate your situation and your bite and aesthetic needs that you might have and really decide what your options are and figure out what's best for you. I think that's, if you're asking me why would people come to Innovative Dental? I mean, I live halfway across the country. Why in the world would I go there? The biggest benefit I feel like we can offer, myself can offer, is the experience of multiple ways of addressing a concern and using some amazing technology to make it predictable and really dialing it in for you. So we don't just have a hammer, you're not just a nail. We don't just have a screwdriver, you're not just a screw. We're able to use a wide tool belt to help address and give you the best result really that you deserve. So that even comes in through our full arch treatment. I get a lot of questions about, do we do all on 4 implants? And of course we do, but I will tell you 90% of our patients end up getting 6 implants. And that's because we want to over-engineer. And you're going, well, no, you're just doing 6 so you can charge for it. We don't charge per implant. So that's a great way to offer our patients the best, right? We're not, we get that cost out of there and go, you know what, whether we're doing 4 implants or 8 implants, we're just trying to put as many and quality implants as we can in our patient's bone to give them the best success for them. And so that's kind of our philosophy and treatment when it comes to full arch implant prosthetics. All right, we have Christoph from YouTube. How long is the process to do a full makeover? Well, it depends. If we're talking about crowns and veneers and maybe a handful of implants, most times it's usually same day. And if we're talking about an implant prosthetic, meaning we are removing the teeth and then we're going to place 4 to 8 implants and then put in a prosthetic that day, that once again is a same day procedure. Now the patient is going to have to heal, right? So you're going to have to, stay on a softer food diet for about 6 months while the implants integrate in bone. And then after that, we convert it to a final prosthetic, which is going to have, zirconia material. It's going to be super slick, super aesthetic, very pretty, or handsome. And so that's how we would address that. But yes, the transformations, almost all of them happen in one day, usually a few hours. That's what makes my job fun, right? So Brittany from Facebook, let's see, you said no Temp Crown for number 8. No, we Temp Crown number 8 all the time. It just depends on that patient. I hate promising that we do it all the time because there's reality that some people hardly have any bone beyond that tooth, or let's say they have an abscess or an infection. Obviously, I can't take out a tooth with a big old infection and place an implant in that site. We're really risking the implant becoming infected. So we're mindful of that, and we really treat each situation uniquely and customize the treatment. But most of the time, we can put an implant in and put a crown on. That's especially in the front, right? Not the back teeth. Can't load those. All right, Cameron on Facebook. How do the gums not change in the time that you don't have a crown? Is this impression still good after 6 months? Well, fantastic question. Somebody's thinking ahead. So that custom or that implant abutment that we screw in, that healing abutment, it has a shape that we design that crown to. And so, yeah, there might be a little discrepancy, but the pressure that we place from that implant crown is going to seat and maybe put a little bit of tissue pressure. That tissue pressure is great because now we don't have traps, food traps. And you maybe heard me when I was designing, talking a lot about how we design the implant crown for the long-term health of the gums and the tissue around our implants. So, there's very minimal change from that healing cap. And we use different size healing caps for the site. So good question. All right. We have Marina from YouTube. how soon after multiple extractions can you place an implant? Sometimes we can place the implants immediately. Matter of fact, if we're doing a full mouth of implants for an implant prosthetic, remove teeth, all the teeth, place implants, we do that same day. About an hour and a half is per arch. So it's a very fast, efficient procedure for the patient. But if we're doing how soon after multiple extraction can we place an implant with infection, that's a different scenario, right? If somebody has an abscess, infection, needs to have some grafting done, we may take a little bit longer, like 8 weeks to 12 weeks, something like that. So, all right, we got a few more questions here. Have we answered them all, Michael? A few more, looks like. Okay, so Cameron from Facebook, are implant bridges as good as individual implants? It depends, right? I mean, implant bridges are definitely very strong depending on the bite. And I do use them as a cost savings measure because you're cutting out an implant, and really you don't need an implant per tooth across the whole mouth. I mean, even if we're replacing, 14 teeth, I'm probably only going to use 8 implants. And so, they're a good solution, depending on the site. Even more of a better solution in the front where the teeth take less load. So great question. Algernon from YouTube. Now, I want to say this. You cannot go from an implant to a natural tooth. So implants won't move, natural teeth do. A prosthetic going from an implant to a natural tooth will cause issues and it'll fail. So you definitely don't want that because you chew on your tooth and it'll move and cause movement on the implant, and it'll cause some challenges and you'll break a prosthetic. So Algernon from YouTube, how do you decide to immediate load or not? There's a couple different ways, right? We have a couple different technologies. One is just going to be basically telling the torque value of the implant. That's one of the best ways to kind of tell, and obviously if you're in a good amount of decent bone, right? If I know I'm only in 4 millimeters of bone, but I got a great torque value, probably not going to be something I'm going to load. But if I'm in 10 millimeters of good bone and I'm placing a 13 millimeter implant, then I might load that implant. So that's a huge factor. There's some other technologies like being able to use sound and resonance. Those are okay, but I kind of like just going by the torque. I usually want to make sure I'm 30, 40 Newton centimeters or greater. And then, like I said, the bite, it's all a judgment, really. I mean, if I have another great solution on somebody who has grinding on their teeth and a terrible bite, I might do what I just mentioned earlier, where I'll use a cantilever bridge and give somebody something to smile with that nobody's going to know they're missing a tooth, and they don't have to take something in and out of their mouth. I might use something like that to lower the risk of a patient accidentally chewing too heavily on an implant that's just been placed in some maybe weaker bone. So hopefully that makes sense. And obviously I'll discuss options with any of the patients after we get 3D x-rays and really dial it in for you. Daniel, but hopefully this is giving you some ways to discuss with your dentist if you're not coming here. So Daniel, YouTube, are there any downsides to implants? I struggle to find any. I mean, they're a fantastic solution for missing teeth. They're better than teeth. I know that sounds nuts, but if you lost your teeth from periodontal disease and from cavities, implants are less likely to have challenges with both of those. So that's a good thing, right? I mean, so we've basically lessened the chances of having future problems. We pretty much eliminated cavities, right? There's no way you're going to get a cavity on a zirconia or an Emax or titanium. So that's not going to be a problem. You can have periodontal disease, but it's a little less likely to see that. So great solution, and better than replacing teeth. I know there's people that are talking about how do we make fake teeth in a petri dish. Well, it wouldn't be as good as what we already have with titanium. It's used throughout the body and everything. Very successful. So Zeef, YouTube, for an anterior implant crown, how do you determine where to put the margin for the abutment, assuming it is a cement retained crown? Well, if you're doing that, you're doing a split crown, right? You're talking about using an implant crown over a zirconia abutment. You're going to have to do some tissue training, whether that's a full contour screwed in. I'd probably recommend that, right? It's full contour screwed in implant crown. That way you're going to have a screw access somewhere out the front or inside the ledge or whatever, but that can be used to train the gums. And then you're going to want to replicate that and place the margin a 0.5 millimeter below. I always try to use screw retained implant crowns for all of our patients because even though I try to train your gums to be at the level of our implant crown height, I can't control 10 years from now. So if your gums shrink and expose a margin between a zirconia abutment and an implant crown, you're going to see that. You're probably not going to be happy. So I try to make sure that I thought about longevity, and if you should have gum recession at all, then we've helped you out there. Another huge benefit of a screw retain prosthetic or screw retain crown is that it doesn't have a margin at all. So bacteria don't really have a place to hang out and cause gum irritation and recession. So that's something I love to do, is try to plan for a screw retain crown. Awesome. Let's see, Salem from YouTube. Do you have any special training or schooling to do implants in the US? I'm currently studying in Europe. So in the United States, technically anybody that graduates from a dental school can do implants. Now, obviously, you're not going to want to just jump into implants. I took some training at Scottsdale Center for Dentistry through CEREC doctors. I've done a number of guided implants. I've probably over 5,000 placed implants. And then did some training with Road Dental Lab to discover how to do full arch implant and hybrid dental lab to do that as well. So I've done some, and that's been out in Las Vegas at the Las Vegas Institute for Dentistry. So there's been a lot of little things to learn how to do that. So much so that I want to share what I've learned. And so we offer an option here called Rheostat. And so at those events here in our office, we have, you can go to rheostat.com, by the way, but in these events, we train other dentists. We've got training for smile makeovers, so with veneers. We've got single implant training coming up as well, and we've done a number of full arch implant prosthetic dentistry with Chrome Guided Smile. We don't just train the doctors, we train the team, so it's a really cool event that everybody kind of gets to see how to provide your patients the best. So if you're a dental professional, go to rheostat.com. Pretty great options for you. All right, Zeef, YouTube. I love these names, right, Zeef? What's going on, man? Well, why can't a full arch be immediately loaded, but not a single implant? Awesome question. So with 6 implants or 4 to 8 implants and a controlled balanced bite, what we've done is we've connected these individual implants, right, with a prosthetic that now helps control that not one implant is being overloaded. And so they kind of work together to help support the bite. Now, obviously, anytime we load an implant, there is a risk of overload. So we stress with our patients and we go over the diet and what their expectation is while they heal. So now with a single implant, we can load them in the front, right, where we can control the bite and we can keep them from chewing on anything that's going to be super heavy. Good advice is if you can't easily cut it with a plastic fork, it's too hard to chew and you are risking overloading the dental implant. So, and that goes for about 16 weeks. So studies show anywhere from about 12 to 16 weeks, we have that implant being locked in bone. We call that osseointegration, but it's basically a fancy word for saying it's locked in, it's going nowhere. And so at that point, the full menu opens up to the patient. They can eat whatever they want. All right, we have Brian on Facebook. Is it possible to split the procedure of an implant and a crown across multiple years? Absolutely, we do that all the time. So it's a great question. How do we work with our patients to find the most effective treatment for you? And then we also work with you on your budget and try to find ways to help you save the most. So definitely splitting it over multiple years is a great solution if you have an insurance that is going to not be able to cover all of that in 1 year. All right, Salem from YouTube. Do you have to worry about the space being left open during healing? Did I skip one? I did. All right. Let's see. We'll go back here. Sorry. Marin, I can't get it. But hey, if you're from Facebook, what is the cost for full mouth implants? So you maybe heard that earlier. No matter where you go in the country, it ranges anywhere from per arch from probably the lowest 18 to 20,000 per arch up to maybe 30 to 35. And there's probably some dentists who are going, I charge more than that. So it just depends on where you're at in the country, but that's the range. There's a lot of factors. I will tell you we're on the mid to lower end of that, and we offer financing options to help our patients afford this care. But the conversions, smile conversions, if you're doing a full mouth, expect to be somewhere around $40,000 to $55,000. I know that's a lot of money, but we're talking about a lot of work, right? And there's a lot that goes into this. The prosthetics alone are probably approaching $10,000 depending on where you're buying them from. quality lab is gonna be expensive. So, we want to do quality work for our patients. I can tell you right now, I get so many patients that wish they would have just gotten it done right the first time. So I encourage you to definitely do your research, but don't risk your smile, your identity. Get this right. Go to a place that's going to care for you. Obviously, I'm going to encourage you to come here. We're the right place to do that, but there are great places around. I don't think there's any better than our team, no. So Salim from YouTube, do you have to worry about the space being left open during healing? How do you keep the opposing teeth from migrating down? So the good news is if we're under a 6 to 8 month healing time, typically we're not going to see too much movement of the teeth. So it's great that you brought that up. Obviously, those that are missing teeth for a long period of time, let's say 3, 4, 5, 10 years, you're going to see shifting of the tooth behind forward, the tooth from above down. And so it can really dramatically change the positioning of everything and mess up the future site for getting an implant. So don't delay if you've had a missing tooth for a while. It also is going to make you need braces or Invisalign to correct this spacing issue. So, but typically if you're talking about extraction and within 6 to 8 months getting a tooth back in there, really within the year, you're pretty safe to not see too much movement. Yeah, good question. So Lizzie from YouTube, if I'm missing a molar and want veneers, can I get veneers and wait on the implant? Yeah, sure. Now here's a little caveat to that, right? If you've got more than a molar missing and you have an issue with your, wear on your teeth and you have a pretty bad bite, it wouldn't be wise to get a bunch of nice veneers and then not have a solid bite to work with, because we want to protect your investment. We don't want you to be banging on your front teeth. I see that a lot. So, but yeah, if you're talking about just one implant, then shouldn't be a problem to, wait on that and get your nice smile. I'm sensitive to the fact that, we all want to interact and live life to our fullest, and we love helping patients that here do that. So, if we can do veneers first and get you smiling, it's great. So, all right, so we got UIL from YouTube. Let's see, UIL 1980, YouTube. Let's go for full arch prosthetic. How are they cleaned and maintained at home? So the great news is that these zirconia prosthetics are the slickest things that you've probably ever seen. And I'm not saying slickest as in figurative. They are literally slick. Like they don't hold plaque. And so I love that about them. And so our patients are going to have great gum health with these. It's easy to clean them with just toothbrush, water pick. Even flossing's pretty straightforward with them. We can remove them. We use an amazing technology that allows us to not use screws, and we can just wave a wand over the prosthetic and remove the prosthetic. So it's pretty easy for us to clean if we need to. But that's going to be fairly rare. I would say less than once a year needing to do that. All right, Jessica, you're on YouTube. Are you only in Missouri? Yeah, we're in Missouri, but people come to us all the time. So we had a number of patients today from out of state fly in and get care. So we would love to see you here. We take great care of you. We have a airport, Springfield Branson National Airport is about 25 minutes from here. And our team, we have experts that'll help you with navigating that. But first go to yoursmiledestination.com. That's going to be in the link in the description below, I'm sure, but yoursmiledestination.com. It's a really simple form fill out there, and then we'll set up a time to chat. So let's see. We got SP from YouTube. What about allergic reactions to metal? So the great thing is titanium is inert, and so it does not interact. It is the safest metal to place into the body. It is the strongest and most trusted. We have placed millions of implants, as dentists have, and they're successful, wildly successful. I've seen some really terrible news articles that are totally false about the way implants are as far as success rates in patients. Really scare tactic stuff. So, and I at least bring that up because I'm sure it's not uncommon for somebody to maybe hear that. But implants are very successful. Titanium in the joints, we use it everywhere. I've got titanium screw holding my knee together after I had an injury when I was 17 and 18. So, trusting dental implants is from a skilled dentist in the United States is a very safe procedure for you. That doesn't mean obviously all of them work, but they're wildly successful, probably more successful than any other treatment we offer. YouTube doing full mouth. Let's see. Can an overjet be fixed with a new smile? Absolutely. So when we're doing a full mouth reconstruction with implant prosthetics, we can do whatever we want. That's what I love about that is we basically start with a clean slate. Sometimes that's where you want to start, right? Because it's just things are out of whack and you're going to spend so much money trying to address things that are really difficult to get ideal. And you're going to spend a lot of money and a lot of time doing that. So the full arch implant prosthetic does give us that solution. And we can idealize your gums, your smile, the shade, the shape, all of that stuff. So, all right, Dala, you're from YouTube. You said pricing for an individual implant. Some places are just the implant and some are all in. Great point. So in our practice, because we're a general dental practice, we can do all the implant process right here in our office from implant. There's the implant post, which you saw in the surgery. There's the implant attachment or abutment, and then there's the implant crown. So those three components are always part of an individual implant. And so we do that all right here. And so we package that as a price. And so our patients are getting, a pretty great deal by putting that all together in one facility. You don't have to go to an oral surgeon, then to a prosthodontist, and maybe back to your general dentist for an implant procedure. So obviously keeping you from having to bounce around. So pretty great solution for our patients there. As far as cost, I don't know exactly, but it's going to range based off your benefits and, the site and if we need grafting, but you're probably talking anywhere from $1,500 or so to maybe $4,000 or $5,000 for the maximum. So it just, like I said, it'll vary based off of the patient. And we are going to go over all that. There's not like any sort of surprises with our patients. So we like to go make that clear before we ever get started with the procedure. So Chris from YouTube, for traveling to you, do we need to get x-rays and records from our current dentists? Will they give them to us? Absolutely. So dentists will give you, if you've paid for those records, they'll give you those records. We can do a records release form and they'll send them to us. And that gives us an opportunity to really have the most effective conversation. When you come see us, though, we are going to take our own records. We're going to kind of get an initial plan, which is very, depending on the quality of the records, is going to be pretty accurate. But we're not going to just go, okay, those records, we're just going to rely on those. And then when you fly to see us, put you in a dental chair, do the work, and be like, oh, I guess that's the records we had, so they were wrong. But we're going to take some new ones. We're going to take the 3D x-ray. We're going to take our own bi-wings when you get here. And we're going to verify everything. So we're going to make sure that we're clear and comfortable with the plan and maybe any contingencies or any changes you'll be aware of. So, yep. So Dala from YouTube. Can you get, great questions, guys. This is awesome. So can you get an implant if you have braces? Of course. Now, if you have the brackets and wires in place, it's a little more challenging, right? So we're going to probably want to remove at least the wire, probably maybe a few brackets so we can get a guide scan. But yeah, be a wise way to do that. All right, so Laura from Facebook. Are full mouth implant dentures the same as snap-on dentures? Absolutely not even close. So think of full mouth implant prosthetics. You hear me not use the word denture because it's confusing. Yeah, I guess you can use that word, but it makes people think of dentures that have these flanges that rest up underneath the gums and cover the palate or wrap around the ridge. These prosthetics I'm talking about, and if you look, maybe a few of the videos I've shown them, but they do not, they're convex, they're not concave. There's no area for food to be trapped. They're going to prevent you from having that same experience that you might have with a denture. Snap-on dentures, they still have to be supported by the ridge. They're not supported by the implants. They're actually just held down by the implants so they don't float away. Whereas an implant prosthetic, is full mouth implant prosthetic is going to be fully supported by, it rests on the implants. It might touch your gums, of course, but it's not using them as support. All right, let's see here. All right, y'all. So this has been awesome. I love the questions. Thanks so much for making this hopefully lots of great information. But if you're a patient that's like, hey, I want to learn more, I want to come see you, I'm excited to see what implants offer in your practice. Maybe you're suffering from a few missing teeth, or you got to get all your teeth out because you're going towards dentures and don't want to have that type of life. Go to yoursmiledestination.com. That's where we can connect. You go there and you fill out the form. Our team will be in touch with you. We'll go over all the details, schedule you a live consultation with me. And then if you are a professional or in the dental field, I would absolutely love to see you at one of our Rheostat events. They're tons of fun. We try to make them, fully engaged with your team. I think everybody that's come has really had great things to say about their experience in our practice and then engaging with our team and what they've learned. And you're going to go home more excited about doing dentistry for your patients than you've probably ever been. That's our goal. And you're going to have a newfound excitement for that. So what's up, Nate Webster? Thanks for saying hello. So, all right, guys. So I'm going to go ahead and tie this into our event coming up in July. So July 7th, be on the lookout for more details, but it's going to be a live, innovative info night where we're going to go over dental implants. It's going to be here in our practice. I'm going to basically discuss, I'm going to show you some cases of, single implants, but full arch dental implants. So if you're in the Springfield area or you can make the trip to us, it's going to be a great night. There's going to be a fantastic offer we're going to give patients that come to that. So we're going to have a sign up and everything. So be looking up for that. We'll have a landing page on our social media. So subscribe if you haven't already to our Facebook, our YouTube, and over on Instagram to be on the lookout for that announcement. I'm excited to do that for our patients. We'll probably have some good, some hors d'oeuvres or beverages, something like to make it fun. And then we'll definitely give you some great information that night. So hopefully you had a great time. Hopefully you learned something. And I know I have. So you guys have a wonderful evening and keep smiling. It looks good on you.